It's video that went viral, a man having a heart attack in his living room. Thankfully, his wife recognized the emergency and called 911, giving him a chance to survive. Whitney Clark is in Phoenix and explains the importance of knowing the signs of heart attack and why it might not look like what you think.
Michelle and Jeff Goss were in their living room before heading to an Arizona Cardinals game.
Does it feel like food stuff, or does it feel like Yeah, sit down.
The season ticket holders had no idea they'd be watching it from the hospital.
At first, it just felt nauseous, and it didn't feel like much at all. I really didn't think it was anything serious. I really didn't.
Turns out the then 53-year-old was having a widowmaker heart attack, a total blockage of his heart's largest artery.
I think I should call 911.
His color had turned gray, and he was just sweating profusely, and he was doing that coughing, kind of dry heaving, and then all of a sudden he said, "My chest hurts." And I was like, oh.
Initially, the symptoms were subtle, and Jeff kept insisting he was fine.
Does your chest hurt? Okay, I'm calling 911.
Let's just try it.
No!
In the video, you see Michelle does call 911, then the paramedics arrive. An hour later, Jeff was in surgery.
I really lost control of my body. My arms are shaking. It just got really bad.
Michelle is now sharing the terrifying ordeal on TikTok as a way to show you what a heart attack can look like in real life.
I was watching a TV show, and the main character's dad had a heart attack, and I was like, that's not what that looked like. That's not what ours looked like.
Her 3 TikToks garnering nearly 10 million views so far.
Movies and TV shows where you see someone has a sudden heart attack, has chest pain and drops and passes out and dies, that's very uncommon that happens.
Dr. William Jaffe is not Jeff's doctor, but he's a cardiologist with Abrazo Health. He says usually there are symptoms before a heart attack that will just get worse over time.
If someone has chest pain or shortness of breath and ignores it over time, that's how you can have some potential problems.
What have been some of the messages you've received?
One lady messaged me and said that, oh my gosh, I might cry because it makes me very happy, but that she had saw our videos, and like a month or so, a few weeks after seeing the video, her husband started to have a heart attack, and she knew instantly, this is a heart attack, and called, and they said
she probably wouldn't have called otherwise.
Wow, what a blessing that she shared that story, and it's saving other people, and perhaps by having more conversations like this, we can spread it too.
Yeah, I like what the doctor said. You know, people are used to looking at TV and they're thinking, oh, like Red Fox, the big one's coming. I have the chest pain and all that, but it really can be really silent. And if you think of pathophysiology, what is happening, you're stopping blood flow. So you can get numbness, you get nauseated. You have to think of all those different subtle things that will occur when you do not have blood flow.
Mm-hmm. Subtle.
Yeah.
I would also want everyone to remember it can happen to women.
Oh yeah.
So frequently the videos are about men having heart attacks, but if you're a woman and you're nauseous and you're having tight chest, that, take action also.
Yeah. Women tend to have different symptoms than men.
Yes, they do.
Heart attacks and all that. So
Okay.
that's why a lot of people don't recognize that little numbness, or they think for women, they always say they're having an anxiety attack.
I was with my ex-husband when he had a heart attack, and it started off, and he had been home, he had been out camping, and there was a fire, and he had to evacuate really quick because we're in Southern California, and he had to evacuate with the boys, and so he had loaded up a bunch of stuff, so he was doing this number, and I'm like, you probably pulled a muscle loading the truck yesterday. Mm-hmm. And as it progressed, it was truly a heart attack. So you have to just be aware, and you have to watch, and then call 911.
Especially when things don't get better.
Yeah.
If there's a progression of anything that appears to be subtle, you definitely want to.
I think it was interesting. He said, oh no, don't call, but she was determined to do that. And my husband and I were on an airplane when he had something similar, and it was terrifying because you feel completely helpless on an airplane. That was a good story, and I hope it helps people.